Okay, adding on to Jesse's statement, legalizing physician-assisted suicide wouldn't benefit society. To propose euthanasia for an individual is to judge that the current life of that individual is not worthwhile. For my first point, euthanasia wouldn't only be for people who are terminally ill. There are many definitions for terminally ill. Terminal illness is any disease that curtails life even for a day. Some laws state that terminal means death is expected within 6 months or less. Other law states define terminal condition as one from which death will occur in a relatively short period of time. There really is not a concrete definition for terminally ill, therefore there will be confusion in trying to determine who is eligible for euthanasia if everybody has a different point of view for it. Some people diagnosed as terminally ill don't die for years, if at all, from the diagnosed condition. Another point is euthanasia would harm women. Women live longer than men, therefore they will be more vulnerable. More women will end up living alone in need of care. Euthanasia requests would occur not because people feel pain, but because they fear future debilitation and dependency. Euthanasia would give pressure to the patients that are ill in many ways. People will get scared and for sure will want to take the easy way out. Most terminal patients seek suicide not because they are ill, but because they are depressed. Many consider suicide primarily because they are pressured into seeing themselves as burdens on their families or society. The next point is euthanasia would lead to abuses. Very few patients would be helped and many would be harmed. It would harm the care of terminally ill patients, for they would be treated differently. Physicians are healers, so euthanasia would be undermining the integrity of the medical profession. If euthanasia is legal and taken seriously, many people will take it as the easy way out. Physicians are healers and are supposed to try their best in trying to save someone's life. The inability of physicians to prevent death does not imply that they're free to help cause death. Especially for those who are terminally ill, it is not good to circumvent the dying process. Patients should not be abandoned once it is determined that the cure is impossible.